Today we're going to go over the practical application of a Wound-Vac in the home. The first thing we're going to do is wash our hands. We're going to wash our hands with warm soapy water for 10 to 20 seconds. And then we'll dry our hands completely. And we'll get back to our patient. And now we're going to start the application process. Always want to keep our gloves close because throughout our wound care process, we want to change our gloves frequently. Before we take the wound dressing off, we want to take it off with gloves on, take your gloves off, and then put a new pair of gloves on. So I'll do that throughout this demonstration. So currently we do not have a dressing on, so we're going to start the wound care process. So the first thing we're going to do, of course, is clean the wound with some normal saline or sterile water, depending on what our doctor's order says. So we've cleansed the wound. You don't see a wound here because, of course, this is a demonstration, but we're going to pretend that our wound is here. We've cleansed the wound. We want to make sure we measure it. Our length is measured head to toe, and our width is measured side to side, and then, of course, we have a depth. We always want to make sure we put our patient's name on the tape to identify in our photo whose wound it is that we're taking, okay? You always want to use a Q-tip to measure the depth and to feel around the inside of the wound for any undermining and tunneling that may be down in the wound. You always want to measure the longest part of the wound, the widest part of the wound, as well as the deepest part of the wound. For a Wound-Vac, we want to make sure we apply a skin barrier, a skin prep around the wound to make sure to protect that from any breakdown and before we place our drape. For this particular demonstration, this is going to be, we're going to use a green sponge, which is for the Wound-Vac. So the green sponge is easily visible inside the wound, so that if there's any pieces or particles that fall out into the wound, we can see them easily. So we've got our wound prepped. We've used the wound prep or the skin prep, and we want to make sure that we drape the wound around to make sure to protect it from any sponge that may come outside of the wound. The sponge on a Wound-Vac, if it's on regular skin, will basically just suck your wound or your good skin and cause it to break down. And Vanessa, my lovely assistant, is going to cut some strips. Each Wound-Vac has its own separate type of drape. This particular drape has a safe trap drape that can be moved after you get it stuck down and will allow, it adheres better to problem areas. So I can lift this up. I might be able to. And then I can stretch it and kind of put it back down and it stays down there. Okay, so for this particular wound, our wound is going to be this shape here. So we're going to cut the sponge to fit that area. You want to make sure to cut your sponge away from the wound so that the particles of the sponge do not get down into the wound. So we've got our sponge cut. We're going to lay it down onto the wound. We always want to make sure that the sponge, we overfill a little bit so that the sponge comes out, because once it sucks down, when it sucks down in there, it can get to the point where it doesn't touch the wound bed where in all the places we need it to. So we're going to put that down there, and we can see that even though it's a little bigger, it's not gonna touch any good skin there. So then we're gonna cover it with the flaps just help it take the. So I'm going to lay this down over the sponge, and the goal is to get the sponge covered so that we don't have any leaks. It doesn't have to be perfectly flat, but it does have to be, there has to be no air. It has to be airtight. And of course, most of the wounds that we come across are not going to be perfectly rectangular and so simple to dress, but this is for practical applications. So we see that we've got it all covered there. And you see that there are some areas where it does kind of lift up, but we want to cut a little piece out here. And this is where we'll put our suction device onto the wound. And then we'll put this onto the area here. I want to make sure we have at least a dime size area for this particular type of suction device. And then we would hook it up, turn the Wound-Vac on, and it will suck down and let us know if there's any issues there with the seal.